I'm Jonathan Miller, a partner on the advisory team for the Bonadio Group with a specific focus in healthcare. So, the topic of today's conversation is the Community Benefit Report in your 990 and your Schedule H. And you might say, John, we just filed this in November and we really don't want to think about it for 10 months. But I want to discuss it while it's fresh in my mind. And over the last 2 months, I've reviewed about 10 Schedule H's in detail and analyzed probably well over 30. And I'm noticing some inconsistencies. So I just thought I would kind of go through it today, what the process is, and how we can do it better. So, first, let's not ignore history. Why are we doing the Schedule H to begin with? So let's kind of go back to your tax exempt purpose. So, really, kind of in the beginning, hospitals kind of fell under this, were tax exempt about through the 1950s because the thought was you're providing charity care. But in 1969, the IRS broadened the notion of charity, whereas they said the promotion of health is considered to be a charitable purpose. So really what they're saying, if you existed and were providing healthcare to your community, that was a tax exempt purpose. And they were then saying you're tax exempt and providing you that position. So we kind of move forward. We go through the 80s and 90s into the 2000s. What we started to see more for-profit investment in healthcare. We saw private equity enter. We see managed care, insurance companies getting in. We're seeing for-profit. But we're also seeing the consolidation of the nonprofit hospitals into large nonprofit health systems. So this started to kind of cause some red flags. So about in 2000, Senator Chuck Grassley, he was then chairman of the Senate Finance Committee. And he wrote to 10 major nonprofit hospitals and asked them a series of questions about their care to the poor and their service to the community. And his conclusion was based on the responses was he really couldn't draw a conclusion. He said it was impossible to get an exact measurement how much charity care and community benefit was being provided by those nonprofit tax exempt hospitals. So this was the impetus for Schedule H. So from there, the Affordable Care Act started requiring Schedule H, and now all hospitals are required to report on Schedule H. So they got to capture the data. They can capture it qualitatively and quantitatively. This one gets some of the folks I talked to a little bit ruffled up. But what I say is your 990 and your Schedule H, out of all the documents you prepare, this is the most widely available document that tells your tax exempt story. If you don't believe me, Google your name in 990 and see what comes up. Right there, typically the first hit should be ProPublica. And right there is going to be, you're going to click the link. There's going to be a snapshot. There's going to be your 990, and in some case, your audited financial statements. So over the last few years, we've seen more of these ProPublica type websites start up, and because what they're really wanting to do is they want to drive accountability to the transparency of tax exempt organizations, including hospitals. So what this means, it's much easier for a layperson to access your 990. It's much easier for the media, your employees, and legislators. And believe me, they're reading through all of this. Last summer, the Wall Street Journal and the New York Times. So again, get your Google going. You can look this up. You can see the types of articles they had after reviewing the Schedule H's. And I had from those reviews, some of my clients were contacted. And our good friend Chuck Grassley, he's continuing to review. Congress is still evaluating and saying, should we be doing more in this Schedule H? Should we be asking them to prove their tax exempt, their community benefit, their charity care, and their financial policy? Should we be asking more of them? Um, Even to the point that some out there believe the for-profits actually provide a greater community benefit and have better policies. I think we all scoff at that initially, but it's at least something we can, we might disagree, but where there's smoke, there's fire. And the perception is definitely becoming the reality on this. And we're seeing more bills in Congress. One of those bills has actually been put forward by Senator Warnock out of Georgia. So it's not just the Republicans and the Democrats as well. He's put forward a bill on community benefit reporting of these tax exempt hospitals. And one can also wonder, does that have any relation to do with the hospital in Metro Atlanta that was in the urbanized area serving the medically indigent and poor closing and basically taking away a lot of the health access they had to high quality care? All right, so now we kind of know the background, we know what's going in. So really, what is the Schedule H? I think we're all pretty much familiar. If you're looking at this, you should be familiar with the Schedule H. You've probably completed it. And a few pieces I like to bring up. So we can look at it qualitative and quantitatively. So the first part, we look at it quantitatively. And us as accountants, we love that part one, line 7, because there's the numbers in there. And we can see how much in real numbers, and then we can see a percent of what those real numbers in community benefit is to our total expenses. And what can we do then? We can even benchmark it. And we have groups that will do surveys for us. And then we can compare where we are. I even do it. I keep a tracker of all the hospitals because you know what? I can go to the websites and get the easy access to the information. So we're talking about some of the benchmarking. American Hospital Association, their survey that they put out recently, their most recent survey provides the data for 2020, and they say the average community benefit is 15.5%. Haney's in New York State, where I am, they put theirs out again, going back to 2020, has 21.48%. So right there, I kind of talk a little bit about the inconsistencies. One of the things we're noticing is those two surveys are 6% different. So what type of data are they pulling? Is New York State that much different in community benefit from the rest of the country? It could be, it could not be. Often what I'll do is when I review these Schedule H's, I kind of look at the percentages and say, and then I go back to my little tracker. I'll look at the Haney's or the AHA data and kind of say, where are they overall? Because I don't not going to go through all your detailed calculations. I just kind of say, where are they overall? Does this make sense to what I know that they do? Does this make sense to what their payer mix is in their population? And oftentimes I'll go back to them and say, hey, you might want to check, that number. But I always say, ask yourself after completing it, does it make sense? Are you significantly above the benchmarks? Are you significantly below the benchmarks? Are you spot on? And is it okay you're above? Is it okay you're below? And is it okay you're spot on? It's something to keep asking yourself. The other part is the qualitative data. Again, there's a lot of opportunities, a lot of boxes checked yes or no, but you have notepads in that Schedule H that you can write about all the great things you're doing to provide access to high quality care in your community. Utilize that Schedule H, utilize that notepad to tell that information and further support your tax exempt position. Um, so kind of now that we look at it and you're saying, okay, Jon, again, no, I don't want to think about this for a while. And I'm saying it's one of the most important documents that you have out there. It's probably something you should be thinking about year round and gathering that information because you can't just start it in September and say, we're going to pick it up. So what are some of the things we could be doing? First, I know it seems like a lot of work, but maybe form a community benefit committee. Bring together your finance people, your reimbursement people. Bring maybe your operations person in there. Maybe somebody from RevCycle is pulling some of the numbers, might be able to provide them a little bit better. Bring in your marketing folks as well. Bring in your foundation, your development people that are actually doing the community relations work and has the ability to track it. And also bring in the clinical people and say, what are you doing that's unique or what is new this year? We want to make sure we're capturing all that data. The other item is look at your community health needs assessment. Sometimes, this is required to be completed every 3 years. There's actually a link to the website that you have to put into your Schedule H and ask yourself, are we actually doing what we said in here? Is there something you can do as part of that community benefit committee to say, hey, you know what, we're putting this out here, we're doing it. Are we actually doing it? Because somebody could read it and put us accountable to it. Again, benchmark yourself to other hospitals and peers. Talked about this a little bit earlier, but does it make sense where you're falling? Is the way you're collecting the data the best way to be collecting it? If you're kind of an outlier to outlier. Other items, again, review. I talked about earlier. Go back, look at that notepad, look at what your peer institutions are doing. Maybe there's some best practices you can pick up from them. Ensure, and basically the other thing is ensure all the individuals in your organization are aware of the community benefit. Make sure you're providing this to leadership before the 990s file. Make sure you're running it by your audit committees or your boards or somebody, because you'd be surprised the amount of the insight they can provide to you on it. And lastly, take it seriously. It's just something we can't do. I keep pointing. One of the things you can tell where I'm coming from. I keep pointing is this is under scrutiny. The tax exempt mission of your hospital is under scrutiny as well because of this. One of the most interesting things that I've had as I presented these community benefit reports and the Schedule H's over the last couple of months to really the audit committees and the finance committees is I had one gentleman say to me, just by our pure existence, we're providing community benefit. He said, you know what? We haven't made a profit since COVID, and it doesn't look like we will be for the next few years. Most other businesses would probably close up or divest just by us being here as a community benefit. It's kind of along those lines. Tell that story. Tell that story of what you're doing, why you're doing it. Say why you're putting healthcare first in the community versus finances first, and tell that story. And also feel free to reach out to me with any questions. As you can tell, this is a topic I love to look at, and I look at a lot of data. Thank you very much.